I've seen and heard enough stories about people not being able to get Paxlovid in terms of it being covered by Medicare and Medicaid that I decided to dive into it. This is one of those stories. So the person was exposed to COVID, took a COVID test, tested positive, called their doctor, and got a Paxlovid prescription. However, when they called the pharmacy to see if the order was ready and to ask the price, they were told that it was not covered by insurance and that the cost was going to be $1,300 each. So, thinking there must be some sort of mistake, they checked online, and most of the info out there, like I've showed you before, by the government is saying that if you have Medicare, they're going to pay you full cost. So, these individuals went back to the drugstore where they were told that this governmental program expired as of January 1st. And then they called their Part D drug insurers and were told that Medicare and Medicaid does not cover this medication at all. And by the time they found out all this information, the window to start the prescription passed, so they couldn't get their prescription and move on from there, proving that this issue is a major limiting factor to people getting it despite them getting prescribed it. So then I moved on to this article, Does My Plan Cover Paxlovid? Where they learned that Paxlovid is not currently covered by Medicare Part D plans this year. And this may be because Paxlovid is provided at no charge through a government patient assistance program called PAXCESS, which is operated by Pfizer for those on Medicare, Medicaid, or other government-sponsored coverage, where you must enroll in this program prior to filling your subscription order in order to benefit from this program. So pause the video here to take down the website or call the telephone number to get this access. And for those with standard health insurance, it seems like it will be covered to a certain extent, where this person's Caremark plan covers $1,191.25 for Paxlovid, so they would pay a $135 copay. So taking a small step back, what is Medicare Part D? Well, if you look in the tiny image over here, it's the prescription drugs part of the Medicare package, where back in December 26, prior to the start of the new year, they're claiming that Medicare will cover Paxlovid under Part D. But of note, about 20% of Medicare beneficiaries do not have Part D coverage, and Part D coverage does not extend to Part A. Another issue is that Medicare doesn't necessarily provide out-of-network coverage, which is problematic because nursing homes are considered out-of-network if they don't have a Medicare signed contract. So ultimately, the timeline tracks. It appears that Medicare and Medicaid is no longer going to be covering Paxlovid. However, it's not surprising that a lot of people don't know about this because up until January 1st, they were still saying that yes, it would be covered. So then, because of this important change in the coverage for Paxlovid, you should be utilizing the PAXCESS program that Pfizer launched at the start of 2024, where the claim is that this will reduce the out-of-pocket costs for commercial Paxlovid antiviral to $0 for patients that enroll in their program. So this is the website, and this is the phone number again that you can use to access this. And this program is relatively new. It just launched December 1st, 2023. But of note, this program is only running till December 31st of 2024. And then to qualify for this program till the end date, patients must be uninsured and do not have prescription drug benefits at the time they fill their prescription, be a Medicare beneficiary or a Medicaid beneficiary.